It's not manual.
Good day and welcome to Health Portal, your ever good medical program that puts you into the know about alternative and homeopathic therapy and medications. Today, like as we normally do on the program, I just have to give you a little bit of an apology on certain things that has lapsed on the program, but I assure you that as always, what the program gives you in terms of good health and how to manage your health, you will always get it. Today, we'll be looking at a topic that is very, very important in everybody's life, and it so happens to a lot of people, and that is frequent urination. But you know that in the program, we do have Dr. Gospower Amadi, who is always on the program every time to let you know that which is absolutely and very, very important for you to maintain your health. Doctor, you're welcome to the program.
Thank you very much.
Yes. Good. Great. You know that Dr. Gospower Amadi is the director of Boundary Specialist Homeopathic Clinic, Boundary Specialist Homeopathic Hospital. You know where it's situated, 34 to 36 Ojuelegba Road, and also number 12 Boundary Road in Boundary Ojuelegba there. He's just trying to get these things across here. It's kind of getting a mouthful. But in the program today, like as I said, you get to know how to solve frequent urinations. But I would also like to inform you that you can be a part of this program by sending in your text messages. Sending your text messages, questions on text messages on the numbers you see scrolled on the screen. The doctor will treat your questions to your satisfaction. And now, before we get into the program, I would like to ask the doctor something very, very important, and that is this. Homeopathy. What is actually homeopathy? Because it kind of confuses people. Sometimes people might think that it is where you mix concussions. You pour this concussion here, you pour this, that. Is it about concussion homeopathy, or what is homeopathy? Explain to our people in very short time.
Thank you very much. Thank you, viewers, for waiting for us once more. Well, to be brief, homeopathy is almost opposite of allopathy. Allopathy is the common medicine we know here in Nigeria and many other parts of West Africa, the one we commonly call orthodox medicine. So homeopathy is opposite of that allopathy. Allopathic medicine is the orthodox medicine. Therefore, by definition, homeopathy means the use of substances which have the power to cause diseases when given to healthy human beings, to cure such diseases when they occur naturally. That is homeo and pathy. Homeo means similar or the same, and pathy means suffering. That is same suffering. If the presenter is healthy and I give him this substance and he suddenly becomes hypertensive, if therefore we see a case of hypertension, we use that same remedy that has power to cause hypertension in a healthy human being and restore him, give him his relief. That is purely what homeopathy is all about.
Okay. Yes, we need to get that clear, because people have asked this question a lot. What is homeopathy? What is homeopathy? And thank God that the doctor has cleared it for you today. Before we go into treating this topic of frequent urination, there are text messages that came in, questions that the doctor has to clear first. Once we
getting relief, if your answer is yes, then legally, socially, and culturally, you are entitled to this information concerning electronic homeopathic medicine. In our electronic homeopathic medical therapy, all you need to do after your complaints is to give us a sample specimen of your blood or urine, which we analyze through electronic computer system, analyzing all your body from head to toe, covering the emotional, the mental, and the physical systems of your body, no matter how long and no matter the name of the disease. If this system appeals to you, then visit any trained and registered electronic homeopath wherever you see it. Thank you.
welcome back from that short break. Like as I said, we will take certain questions that came in first, so that doctor will clear those before we go into the topic for today, which is frequent urination. And if you're just coming in to watch us, you are watching Health Portal. Health Portal is your program on health that treats alternative homeopathic medicines or medications. So now, the first question we have to treat goes like this. Doctor, this question came in. He said, I have itching all over my body and also internal and outside hotness of my body. My friends say that my eyes are greenish or reddish and I have pain in the right side of my body. What do I do? Which is he's asking, this itching all over his body and his eyes are always red and all that. What does he do? What will he do? What will the person do?
Okay, the person did not mention his name, neither did he mention the age or the sex of the person complaining. However, as we said some time ago concerning movements in the body, stroke, hotness of body, we refer to such conditions as being preempted by conditions affecting the liver, wherein we mentioned hepatitis B virus, and all its subordinates. However, this person is talking about general itching of the body. It is still not far away from our topic then, because this itching, whenever you see itching in the body, there could be 2, 3, or 4 things that may be behind such itching. One, there could be rheumatism. Secondly, sometimes there are some types of infections on the skin that may elicit itching of the body. But with regards to the topic that we have been handling for some time now concerning the liver, itching can also be highly pronounced, especially because the liver itself secretes some certain enzymes, some certain substances we refer to as heparin. This heparin have the capacity of inducing itching in the general parts of the body. And also, it is more indicated when your friends say that your eyes are tinging either greenish or yellow or red. You can see that it's better you let your doctor see this, and I think he might like to refer you for liver function test. But with that discoloration of the sclera of your eyes, it's likely there is obstructed jaundice. There is likely to be jaundice there. And also, it is more also confirmatory when you say you have pain in the right side, which is suggesting that the liver is highly affected. So if that be the case, the liver being affected, then you may need all the liver remedies we have, things like chelidonium, things like lycopodium, and things like that may take care of the liver. If your abdomen is also swollen or painful as you refer to the right side, then you may need the remedy we call Bryonia alpha. If not, let your doctor see all these things and he may have the best knowledge of what to do. Or rather, you may make use of electronic homeopathic analysis computer, which will rightly indicate the exact thing that is wrong with your body. Confirm this.
Well, I hope the person that asked that question is satisfied, and I hope you too that is watching. If maybe you have such a problem, probably you have gotten your answer now. But the best thing I say you do is simply get to Boundary Specialist Homeopathic Hospital, 34 to 36 Ojolema Road, or at 12 Boundary Road in Ajegule. The second question says, Doctor, I have movement in my body, but only in my abdomen. Now, he said like a load of things within his or her abdomen, because the question goes there that it seems as if I'm pregnant, which means the person that is asking this question is a female. So he said that this movement, especially in the abdomen, makes her feel as if she's pregnant. And then he said, I have not seen my menses for the past 2 months now. She has not seen her menses for 2 months. Movements in her body, especially in the abdomen, that makes her feel that she has.
Okay, in that case, being a lady, the movement in the body we have been talking about is general body movements, but sometimes they can also be localized in some areas. But in your own case, that is felt in the abdomen, and you are a woman, and you are feeling as if you are pregnant, I think it is better for you to meet your gynecologist or meet your doctor and or you go for your antenatal checkup, or more better, you go for pregnancy test. But in my knowledge as electronic homeopath, I know that sometimes some women lose their menstruation for 2 months or 3 months, and they have that sensation of movement in their tummy as if the hand of a baby is moving in the tummy. In that case, if that movement is not as pregnancy, it's likely to be due to suppressed infection, which is manifesting that way. It's a sensation, it's called sensation as if the hand of a baby is moving in your tummy. In that case, the remedy we use is Thuja occidentalis. Thuja occidentalis is sold in the market everywhere. You meet the people that are selling local materials, but as homeopathic, you must have to potentize it homeopathically, that is scientifically attenuate it so that it becomes medicinally of use, or you make use of the electronic computer that homeopaths make use of. But the best is to go to your trained and qualified homeopaths. He will be able to tell you exactly what to do. But if you use Thuja occidentalis, you will see that that movement in your tummy will stop. Some other times there are some other movements that occur in the abdomen, but without exactly the sensation of a hand of a fetus. In that case, those movements in the tummy, like ants or the rest of them, we use the remedy we call Crocus sativa. Crocus sativa will stop that and re-establish the flow of discharges, which will re-establish the infection. That is to say, bringing it out from the suppressed form into the practical physical form, and that will ensure your relief. I'm sure of this.
Well, that is great. That answer, I think, has satisfied the person that sent in that question. Doctor, the third question says, I have movement all over my body, as if walls are moving, and sometimes hotness all over my body. Now, he says, this gives me restlessness and sleeplessness.
Okay, this exactly is the one that falls into line with the topic we have discussed recently concerning movements in the body and hotness of the body in relationship with hepatitis B virus. This case is saying that there is movement all over the body. And I remember I did tell you that this type of movements in the body systems, they are categorized in different dimensions according to the sensorium it is using to explain itself. This one clearly states that the movement is like one movement. And in electronic homeopathy, when we see movement like one movement, the remedy specific that must give you relief is called cocainum. Cocaine is the drug that is illegal in worldwide, is easily abused by people, and that is why it is prohibited and tagged a very dangerous drug. But when you meet your physician, your doctor, he can be able to prescribe that which is legal for you, and that is to make use of the re-potentized cocainum. Electronic homeopaths know that cocainum, to prepare it, we use the raw cocaine, or rather, since the programmed electronic machines are all available, with the right number of cocainum, you can get cocainum as a remedy according to the potency that your body needs, and then you will see that you will get the required relief. Just try it and see.
That is great. Certain things that you have mentioned there about the cocaine and all that, please get the doctor right there for you to know that it's simply medication. And now, doctor, the fourth question says, doctor, why is it that by 4 p.m. every morning I'll be woken by severe pain in my waist until daybreak, and also by 4 p.m. again I have heartburn or rising gas? What do I do? Say normally by 4 p.m. he's woken up by this pain in the waist, then that is by 4 a.m. in the morning, and then 4 p.m. also the same thing occurs, and then it's like rising gas.
Thank you very much. It's very simple. If you had followed our lessons on miasms, that is the secret causative agents of diseases, we did mention that there are 3 causative agents of chronic diseases. These 3 include the SORA, the psychosis, and the syphilis. So I don't know, as he's signaling, maybe when you are through, we can talk that.
Yes. I think we have to go for a short break. We'll be right back.
symptoms without getting relief? If your answer is yes, then legally, socially, and culturally, you are entitled to this information concerning electronic homeopathic medicine. In our electronic homeopathic medical therapy, all you need to do after your complaints is to give us a sample specimen of your blood or urine, which we analyze through electronic computer system, analyzing all your body from head to toe, covering the emotional, the mental, and the physical systems of your body, no matter how long and no matter the name of the disease. If this system appeals to you, then visit any trained and registered electronic homeopath wherever you see it. Thank you.
Yeah, welcome back. Before we went on that short break, the doctor was answering a question that somebody asked and said that early in the morning, 4 a.m., he or she, because you didn't indicate here, is woken up by severe pains in the waist, and also, by 4 p.m., the same thing, and then rising gases. So, doctor, you were,
yes. So, as I was explaining, if you had followed the miasms, which I termed as disease secret causative agents in homeopathic medicine, both classical homeopathy and electronic homeopathy, you see that SORA has its time of attack on individuals. Psychosis has its own time of attack on individuals. Also, syphilis has its own time. Even tuberculosis, which is the fourth miasm, has its own time too. However, whenever SORA is there, remember that SORA action will tend to disincline any movement. That is to say, the functionality of the hand or the leg or any organ of the body is being reduced. And if that be the case, it will usually strike between the hours of 7 a.m. to 11 a.m. and more especially from early morning till that time. And that is SORA for you. If it is psychosis, that means suppressed venereal diseases. The time of attack is usually from 4 p.m. to that kind of 10 p.m. And if it is of syphilis origin, it is usually from 2-3 a.m. till 7 a.m. in the morning. So in this case, we are not surprised. In electronic homeopathic medicine, if that pain arouses you by 4 a.m. in the morning, then it's likely to be associated with the remedy we call calicab. This calicab has that characteristic of rousing up with a severe pain, especially along the spinal cord, towards the base of the spinal cord, where you may call your waist or the small of the back. This severe pain is as if it is breaking, and it's usually by 4 a.m. and before 8 a.m. it will have released you. But people are forced to seek for relief or treatment because of the severity of this pain. So when you come out that time, carbonicum will be used. But in the case of also being disturbed by 4 p.m., that means that there is also psychosis in your system. Remember, we did say that there are combination or many cases where cases are complicated. In that case, the person may be suffering from SORA, may be suffering from psychosis, and also syphilis. But in this case now, you will easily see it that this person is suffering both from psychosis and syphilis, because psychosis itself will have its aggravation from 4 o'clock p.m. to 10 p.m. and that 4 o'clock p.m. will give to the remedy we call lycopodium. When you use lycopodium that time, you will see that the rising gas will stop. It will be as if there is aortitis, that is inflammation of the aorta. It will be as if there is hot gas rising from your chest towards the mouth, or what we may call something like esophagitis, and yet not that. As if there is hotness in the heart rising up or vapor rising up. It is also seen in syphilitic cases. And since you have psychosis and syphilis, which are indicated by these two time points, 4 a.m. in the morning and 4 p.m. in the night, you will see that both calicab and lycopodium will give you perfect relief, and I think you will be glad with that. Thank you.
So, I tell you, viewers, if you don't watch this program, I am telling you, you're missing a lot. And you that is watching it, I thank God for your life, because you are gaining a lot. I tell you, the doctor has taken those questions, and I would say, like to remind you that you can send in your questions, you can send in your comments through text messages on the numbers you see scrolled on the screen. Now, with the remaining time, doctor, I think we have to go into what our topic is for today, and see if we can really do it justice. If not, then probably we'll continue next week. As you remember, I told you that our topic for today is frequent urination. Now, Doc, what we are saying is this: somebody urinating frequently, especially at night, 10 times, 15 times. Frequent urination, what is it?
Okay, thank you very much.
Yes.
So thank you, viewers, for still being patient with us to answer those questions of the past. Frequent urination may actually not mean when you urinate up to 30 times. But then we can define frequent urination as the tendency to go to urinate often. And that comes when after urinating, and then it calls again. Now you remember that it's not long now that I have urinated. Why am I urinating again? That is a special indication for frequent urination. Frequent urination can be caused by certain factors which we will name now. One of the factors that may enhance frequent urination is the environment. The environment includes the weather condition, the temperature of the day, and all the rest of them. You can see with me that whenever the atmospheric temperature is very low, when there are heavy raining, the temperature is usually very low, and then the body mechanism tends to harmonize its functions. That is to create what we call homeostasis. And in trying to do so, we'll try to use the eliminatory organs of the body to eliminate fluids which may as well turn down the temperature to be conducive enough for the body. In that case, this eliminatory function of the body is usually done by the kidney. So you see people urinating frequently during such rainy times. So this is not a problem because your body is working well and trying to maintain you in a good form. There are other causes of frequent urination, like things we may refer to as infections. Infection can cause frequent urination. Such infections like urethritis, which the germs may now ascend along the urethral canal to affect the cervical point, and in that case will cause irritation in the bladder, and there may be frequent urination. So such one, when your doctor is consulted, it's likely he will refer you to laboratory for culture so as to elucidate the primary cause. There are other factors which may include now what we may call cystitis. Cystitis simply means the inflammation of the urinary bladder. If the urinary bladder is affected somehow, then you can see that frequently, whenever you take fluid, there will be that tendency to remove fluid through urination. But the most common type of frequent urination that is always problematic is what we usually call diabetes. Okay. You can see that diabetes is a problem in many people because there is that frequent urination. But then, diabetes can always be classified into different types.
Yes, Doc, I think that we will get into this detailed explanations in the next program. Viewers, we have run out of time, and this is the most that I know that we can take on this particular episode now. But please, make it a point to be with us next week, because you really need to know, get the explanations, the medical and the health implications of whatever it is that is the problem with you and your health. Till we come again next week, Doc.
Yes.
Yeah. Thank you very much. Yes, and yes, thank you very much too for being there for us.